So today I'm just going to talk to you about one of my favourite topics, which is resilience in older age. And I'm going to keep my notes handy because this is a topic that I could talk about for hours, and I know I've got 15 minutes. So I'm going to talk about resilience and how we might draw on this theme of resilience when thinking about strategies to combat loneliness. So just a little bit about me. I'm a Professor of Aging and Dementia Research, and I lead the Aging and Dementia Research team at Bangor University. And I'm also the Associate Director for our Wales Centre for Aging and Dementia Research, which is CADA, and you've probably seen that logo a few times today. And CADA is a collaboration between Bangor, Swansea and Cardiff universities, which sees people working together from the backgrounds such as genetics through to ourselves, health and psychosocial research, into taking our research into the health and social care setting. So quite a unique collaboration in Wales. So we know now that resilience regularly features in health policy, and here are just some examples showing the international interest here from the World Health Organization in the topic of resilience, and also to that from our own government, which is the Wellbeing of the Future Generations in Wales Act. And a really wonderful aspect of resilience is it is a very diverse concept. We can explore it in different contexts, from different scientific backgrounds, and at any stage of the life course. And this whole notion of resilience is something that I think is intuitively, we all think we know what it is, but I think if I was to ask you today, can you tell me what resilience means to you? We would all have some different opinions on exactly what this is. Because of that, it is not without its criticisms in the research arena at least, particularly in ways in relation to issues about how we define it and how we measure it. And that might, to you, it may sound very trivial, but if we aren't very clear on what resilience is, then it has implications for thinking about the kind of services and interventions that we might develop to build it in people. So what I'd like to do today is just firstly present some work around the definition of resilience that we've done here at Bangor University, and then I'll make a few suggestions for how we might measure it, which some of you may find useful. And then I'm just going to describe a couple of projects that we've been involved in that I think promote resilience. And then finally, I'd really like us to consider a final criticism around resilience, and that is resilience and inequalities. So let's just start by thinking about what we mean when talking about resilience. And this came from a piece of work a few years ago that was funded by the Medical Research Council, where we were exploring the role of resilience in healthy ageing across the life course. And that brought together people who were delivering services for children, but also older people's services as well, along with academics and members of the public. And we first of all explored our own thinking about resilience and what it is. And here you can see there's quite a diverse range of opinions offered about what resilience is. This certainly reflects people thinking it's something about the person themselves, their inner strength, but also something around the cultural context and the services that are available to help support people's resilience. And so there's also that wider environmental aspect that comes into it. So then we used this qualitative work, and we blended this with a major review of the academic and the grey literature on resilience, all the research that had been undertaken on resilience from children through to older age. And in total, we had about 271 papers, which we kind of synthesised to pull together into a working definition of resilience. And this is what we felt resilience is, and that is it's a process of negotiating, managing and adapting to significant sources of stress or trauma. Assets and resources within the individual, their life and environment facilitate the capacity for adaptation and bouncing back in the face of this adversity. And across the life course, the experience of resilience will vary. And it also then, from this work, we were able to simplify 3 key requirements for resilience, which are very useful for us when we're thinking about how we might define it and measure it. And first of all, there's got to be a significant adversity or a risk for a poor outcome. This isn't just getting up in the morning and having a bad hair day and not feeling great. This is something major. that ordinarily would be associated with a poor outcome. But then we know what we're observing is that actually the outcome isn't bad in the face of this adversity. It's good, or better than we could be expected in the face of these challenges. And that's because the person is able to resist, manage and adapt to the adversity. And we put this together into a resilience framework which we've published. At one time this is quite a theoretical framework, but now we're developing the evidence base to actually confirm aspects of this. And this assumes again that the good outcomes are achieved because of this bit in the middle, this what I call the resilience reserve. And I think what is important is this is not an internalised model where the responsibility for resilience rests purely within the individual. And it recognises that a resilient outcome arises from the individual and the environment around them, and can support people to deal with the health and social disadvantages they potentially face. But then, of course, when we're undertaking research or delivering services that are required to evidence the impacts, we probably want to measure resilience somehow. And you might be pleased to know there are a range of resilience measurement scales available. And these are quite commonly used in research. Some work we did a few years ago, we took a good look at all the available measurement scales of resilience and found that of the 15 that we looked at, only 5 actually perhaps attempted to measure resilience across those multiple levels that we demonstrated in the framework, and most actually focused just on psychological resources or the inner strengths, but they are widely used. And again, another way of measuring resilience is kind of more indirectly, and to take a range of measurements. And as an example here of how we can test that theoretical framework, this is a piece of work which examined a social model of loneliness. And in this study, we showed that, not surprisingly, disability, which is the box here on your right, had a negative relationship with loneliness. So the more problems with physical function somebody had, the more lonely they were, as evidenced by the blue line. But what we also found, that actually people who had more social resources available to them had fewer problems with loneliness. Again, not groundbreaking. But when we put all three together in what we call a mediation model, we found that having more social resources actually mediated or weakened this negative effect of disability on loneliness. And this work is from a cohort study of older people in Wales, and isn't an intervention study as such, but I guess it's quantitative data that we could consider as kind of proof of concept, providing some evidence for service development. But when we're thinking about building services, what can we do to support resilience and good outcomes? If we are thinking that aspects of resilience, the resilience reserve, such as this, are important targets for intervention, what services might support this? So the first example I'd like to offer you is from a study that I led called Dementia and Imagination, which recently was undertaken in England and Wales and looked at the role of the arts for improving the lives of people living with dementia. And here in this paper, we just focused on how our visual arts intervention provided opportunities for resilience in 4 care homes in the northeast of England. And the data we used were from 48 people living with dementia, arguably a very vulnerable group because they're at that advanced stage in the care setting, and also 37 staff carers or family members. And we analysed this data qualitatively, drawing on that resilience framework previously presented. And again, this is another example of how you can measure something indirectly or qualitatively. And what we actually found that the visual arts activities, these supported the resilience of those living with dementia through enabling creative expression, facilitating increased communication, improving self-esteem, and positively influencing relationships between people living with dementia and their carers and family members. And we would suggest that this is really important for those with advanced dementia, and it shows that people, even in those advanced stages, are capable of demonstrating resilience. which can be supported by and explored through visual arts activities. And another example I'd like to share with you is the Cadwyn Moore Befriending programme. Some of you may be familiar with this. It was a service developed by Age Cymru Gwynedd Môn under the leadership of Helen Ellis at the time. And we at Bangor University were contracted to undertake the evaluation of the programme, which ran over the 6 years of the delivery. And in this programme, volunteers were trained to be buddies and provide one-to-one support to deliver the Cadwyn Moore programme. And this took the form of individual personal support, building up to support the clients to join existing community groups and networks. So it was very much about the buddy, helping that person to link. It was about being a bridge into becoming a little bit more independent. And just to look at the kind of people who they were targeting with the services, we asked people at the start what they wanted to get out of the service. And it was actually really simple stuff. When we think about our lives today, we get up in the morning and we jump in our cars and we zip here, there and everywhere. These people just wanted to get out. They just simply wanted to get out of the house. It was that simple. They'd lost the confidence, perhaps they'd had falls, and they were living alone, and they really just needed somebody just to provide that initial helping hand. And our evaluation identified a number of positive outcomes, but particularly in relation to today, what we did find was that of the 114 people who provided data, so we collected data on loners before they took part in the programme and at the end of the programme, there was a significant reduction in loneliness through the Cadwyn Moore programme. And then finally, this is something that kind of bothers me a bit, because I think most of us would agree that resilience has its use in research, policy and practice. But I do think we need to think a lot about the messages we are sending, because there's a growing narrative now around shifting the responsibility for health outcomes from the policies of the government institutions onto the individual. And so this really focuses personal responsibility for being resilient. This whole notion that people should be able to help themselves, and perhaps inadvertently downplaying the social inequalities that may exacerbate the conditions that put people in that situation in the first place. It doesn't always reflect the material realities of people's lives. And we are now in a time where services are being withdrawn and reduced. So with that in mind, and really from a social justice perspective, I'd just like to leave you with a couple of questions. Is how much adversity should we be expecting people to endure? And how can we make sure that our efforts to build resilience actually don't widen inequalities further? An example of that, I would argue, would be older carers of people living with dementia, who in many instances have no choice but just to get on with it. And indeed, our research has shown, demonstrate huge resilience. But over the long term, how much does this become depleted? And what is a limit for resilience? And it surely cannot be an endless supply. And I don't have the answers to these questions, but I would welcome your perspective on this, as I think it is really important that when we're thinking about resilience and loneliness together, particularly some of the things that we see that could be described as resilience may have negative impacts in the long term. So thank you.